from a couple state updates related to some consent management pilots that DHCS will be putting out there shortly, so we can cover that, as well as some recent CalHHS subcommittee meetings as well. And then any other items folks would like to bring up, and we'll cover some recent news items too. So please feel free to introduce yourself in the chat if you'd like to. I'm Robbie Franceschini with Blue Path Health, and we help to facilitate the coalition. Really, we developed this vision with partners. Last year, really health data is connected across the state, and that Californians and their various providers and other organizations really have the information they need to make care more seamless and quality and affordable. We support policy that builds capacity to support participation in statewide information exchange and health data infrastructure, and have really been focused on funding, understanding how to shape the mandates that the state has been putting out there to share data, building that needed infrastructure, and providing feedback to our state leadership as well. And just to revisit too, some of the key ingredients, as we've been calling them, that we think are really kind of key to successful data exchange in the state and for the data exchange framework in California. And I think as a big focus of our content has been recently is really around, some of the public health and the CalAIM or social care use cases too. So with that, I think we can go ahead and dive into some updates, and welcome if folks have anything else they'd like to share related to these items or questions. Feel free to put those in the chat, or unmute yourself if you'd like to too. But the first one is really around this upcoming funding opportunity related to CalAIM consent management pilots. So this, it was a webinar hosted this week by the Department of Healthcare Services around these pilots that they really are expecting stakeholders to apply for, hopefully under the auspices of CalAIM, with a couple of key outcomes of interest that they'd really like to look into. So one is around being able to collect feedback from consumers around consent management pilots in the state, and understanding what consumers would like to see in terms of how their consent is collected and managed. Care coordination is another focus area. So what does data exchange look like between managed care plans and county agencies in particular within CalAIM? And then lastly, around kind of building infrastructure. So understanding what the need is when it comes to, any capacity for centralized consent management systems, and how this might support the California HHS data exchange framework that's going on at a higher level. So a couple things they shared. One, they're expecting participants to leverage the authorization to share confidential medical information form, the Ask Me form, which is a nice acronym, but that has been developed for CalAIM for data authorizations. They envision that HIEs or CIEs would be the primary respondent, and would like to see them include counties, managed care plans, and any CBO or provider subcontractors ideally would be participating too. Within the CalAIM context, they in particular pointed out that within counties they'd like to see behavioral health, specialty mental health, and drug Medi-Cal participating, and CalAIM enhanced care management and community services providers in particular. And then just additionally, they mentioned they're looking to fund up to $300,000 per pilot and up to 3 pilots in the state. And that, an RFI is expected as early as this week. It's Friday, so we may see that in the DHCS newsletter later today, or maybe sometime in the next week or so, and that they're hoping that the pilots start by April. So I'll stop there. I don't know if folks had anything else that they caught during the webinar that would be useful to share, or any questions about the pilots at all. Is anyone looking to maybe apply, or any HIEs on the line that are thinking about putting in an application potentially?
Hey, Robbie, this is Felix with Manifest Medics. Yeah, we are looking into it for sure, and also reaching out to some of the counties and managed care plans that we would have in mind to go in for this. Nothing official yet, of course. One thing that does, I don't want to say gives the pause, but we want to just point out, observe, is that 300,000 is not going to cover a whole lot when it comes to building a consent management system as the pilot envisioned. But obviously we will see what's potentially feasible.
Yeah, well, and it sounds too like they may be expecting HIEs and partners to leverage existing resources. I wonder if that may be something in the RFI too, just given, I think, as you point out, the funding amount and the pretty brief timeline. Dan, I see you unmuted yourself.
Yes, sir. Yes, Shia will be pursuing and investigating. I don't have all the proper sign-offs and buy-ins quite yet, but all the indications are good that we'll be pursuing this opportunity, Robbie.
Excellent. Good to hear.
Did we get a sense that they want like 3 different pilots to be like A/B testing, or doing something in a coordinated way? Like, will it be a free-for-all with some really high-level requirements, or is there going to need to be some coordination and demonstrating that this can work across different geographies? Did anybody get a sense of that?
Yeah, Dan and Felix could correct me, but I got the sense that they're looking for 3 pilots as 3 kind of sample subsets, each potentially having different approaches to addressing the workflow as they explain it. And I'd offer 30 seconds of personal commentary to Felix's point about the 300K. I kind of get the sense, having been involved in various different consent management architectures and approaches to consent electronically, that they're kind of encapsulating the paper-based, here's a form, and it can be updated dynamically, and there's rooms for doing that electronically, but a truly enabled electronic consent procedure is still a ways down the road a bit. So I think this is kind of baby steps.
Did they mention anything? And I had to miss the webinar for another meeting, but anything around, what's currently being done within CalAIM today? I know a lot of counties, I see you shaking your head, Dan, like, is there any, like, what the, their reasoning is, I guess, or their rationale for pursuing these pilots, or if it's just really kind of to test and see what comes?
There was a document released last year that was sort of a status of the state of the art. I can share that, Robbie, and you can distribute it. But beyond that, they didn't reference anything. And I share Jim's perceptions. I really do think that's what they're trying to do, is compare and contrast the 3 different pilots. And it's not clear, at least from the presentation, as to how much of the existing, probably paper-based workflow needs to be incorporated. And I see Rosemary's hand up, and always want to hear what Engine's doing.
Well, hi, Rosemary Denowden from Engine. Just wanted to indicate that we are very interested in this. We've been looking at consent management for quite some time and are going to be actively exploring this, but I agree with everybody's comments thus far.
That's great to hear.
Is there sorry, Robbie and Stephanie and I are all in the same room together. We're trying to figure this Zoom thing out. But is there an opportunity to match this funding? Is there another, like, I'm just thinking out of the box here, but is there a CalAIMS, specific funding that could be tapped in, and
Path funding
potentially? Like, why are we looking at this as single-handedly? Is there foundation funding that we should be going after?
I think it's a great suggestion, Timmy, that we should tee it up. They didn't really leave a lot of time for questions. I would hope they have a bidders conference. And I would recommend you suggest that. Arguably, there are tenets of the behavioral health quality improvement program that support this, to your point, Timmy.
Good point.
But I think it's a great suggestion, especially given the fact that they want mental health and drug medical as part of this. That, I mean, arguably, if your county is participating in behavioral health quality improvement program, that'd be a good way to maybe augment some funds. I haven't quite figured out how to do that yet, but I again agree with Jim and Rosemary, Felix, that 300,000, depending on what you're trying to do, is not enough.
Yeah, and I get the impression that, you know, as you see in the slide, the RFI comes first before they move forward with pilot selection. I think there's an excellent opportunity in the RFI to lay some of this out and suggest additional funding, you know, either from CalAIM or from other sources, because we just collectively respond and say there's no way to get from here to there with 300K.
Well, it's not clear to me, if it was an RFP or an RFI. I think they were unclear on that or inconsistent, Jim. And I don't know if anybody else heard that.
That's great point, Dan.
A lot of the procurements coming through RFIs right now. I would welcome any of you that have ideas on other funding sources, including foundations, that we should make sure they're aware of this opportunity. Many of the foundations that I know are involved in consent are outside of California. So, you know, there might be some folks outside of our regular dance card. And then those that are involved or may be interested. So please send us your thoughts.
I hear you. This is Melissa from CHF. I'm hearing this.
Thank you.
Awesome. Any other thoughts or questions at all? Awesome. Thanks for sharing the data sharing authorization file in the chat, Deanne.
I think that might be what Dan referred to, not sure.
Great. Okay. Yeah, we can share this out with folks. There also is a data sharing guidance around CalAIM 2 that DHCS put out, I think late last year, just around how they envision, you know, compliance with various consent and authorization laws looking within CalAIM programs across the state.
Yeah, and this December 21 one was for public comment, so there should be a final one since then that I just didn't see yet.
Okay. Yeah, I think that the hyperlink in here is to the final one. I know the one you're talking about because that's the one that comes up first, I think, on Google search. But we can make sure to share this out with folks too. And I think just one thing to note too, when we say, you know, they're looking at this within the context of how it supports the data exchange framework, I think in particular, the digital identity strategy and what the state may be looking to build out or invest in within that kind of piece of the DXF. Excellent. Well, I think, you know, send any thoughts, or if, you know, folks are, you know, putting in applications or RFI responses, let us know. As Timmy said, we welcome collaboration. So, and let us know how, you know, we as staff of the coalition can assist too.
Yeah, and I threw in there that I think we should come up with a blog or something that's, look at that. It's like we have our own cameraman. But I would love to come up with a blog that we can co-author. So if anybody, I know you all are some experts in consent, so reach out to us and let's do that and start leading this conversation. This is exciting. It's exciting that it's coming out.
Yes, and I think as was mentioned too around PATH, you know, the PATH collaboratives, which for those of you who aren't as deep into CalAIM, these will be collaboratives created across counties and I think regionally to help this community-based organizations and social services organizations within a collaborative framework, understand how to draw down funding that's available for capacity building efforts for enhanced care management and community supports within CalAIM. So that's where I think that there's potential overlap in terms of the strategies and roadmaps that they create in order to kind of collectively draw down funds. Jim, I see your hands up.
Yeah, actually, I have a question for the other webinar participants. To your point, Robbie, I remember a question in the chat where somebody asked, rightfully about, is this only pertaining to clinical data and what we're doing about social services data with regards to consent? And I don't remember the topic being answered in the discussion. So Dan, Rosemary, Felix, if you remember.
Yeah, I
Jim,
think one.
Go ahead,
Go ahead, Dan.
Felix. Go ahead.
Oh, yeah, sure. The slide that they put up a couple of times on the astral form, which I haven't seen their draft, but they also said that they would release the draft form along with the RFI. The data elements that they were looking to capture included corrections with some limitations, housing and homeless support services, as well as obviously the main biggie, right, which is the 42 CFR Part 2, explicit consent for substance use services. I did ask, and they actually thankfully clarified that even though PHI is listed as a data element to be consented to on the form, that they don't intend it to actually create an opt-in for just regular, otherwise HIPAA covered data sharing.
Yeah, I would agree, Jim. It wasn't explicitly answered, but it was inferred. And I mean, I certainly agree with everything Felix said, but the inference, right, given county and MCO participation, is that in my mind, SDOH, if it's not a firm requirement, is expected.
And when you say SDOH, Dan, you mean participation from like CBOs that are participating in ECM or CS? Okay.
Exactly. I have to believe the strength of the proposal will be inclusion of a few CBOs, right? And getting that information properly released so it can be shared between county behavioral health, MCO, HIE providers, et cetera.
Mm-hmm. Yeah, I think that makes sense. All right, well, yeah, keep us updated. We can make sure to share out materials too. And once the recording's posted, we'll share that in our news roundup as well. I think just moving on to other state developments, we wanted to report out on the recent subcommittee meeting around policies and procedures within the CalHHS CDII group, as well as the Implementation Advisory Committee meeting that happened just yesterday. So I think just looking back to the last PNP meeting, I think what staff really laid out is, just reiterating again what the prioritized topics for PNPs in the near term are. So these are the 5 topics: information blocking, and there's a lot of really great, robust conversation around that we can share out in a moment. Monitoring and auditing as well. Number 3, they packaged together the required transaction patterns and technical requirements for exchange. And then 4 and 5 are real-time data exchange, which we kind of haven't gotten to yet in the discussion, as well as qualified HIO designation as well. So just to, recap the last PNP meeting, really a lot of the conversation was really focused on information blocking, and a lot of really good conversation about what is the state's role in terms of trying to extend information blocking to everyone under the data sharing agreement, knowing that only a subset of signatories is subject to the federal rule. So there's a lot of discussion around, how can we further refine what social services information is to really distinguish it from PHI, and where is there a clear delineation? Also to where might we want to diverge in some ways when we're thinking about applying information blocking in a social services context? There's, the idea came about, do we want to get rid of the knowledge requirement under this new state rule? That it might be too up to interpretation, if you will. Another that came up is, how can individuals report information blocking complaints? Could we potentially set up a portal in the state for people to be able to report information blocking? And then additionally, a couple other items around the exceptions under the federal rules and how we might translate that into this DSA PNP. You know, what does a risk of harm mean in a social services context? How does it maybe diverge from healthcare? Do we want to consider psychological harm in addition to physical harm? What might that entail? Additionally, how do we think about how people can maybe, I thought this was a good way of describing it, avoid like forum shopping, where someone who in a healthcare, under like a healthcare organization might not be able to access data because they don't have authorization, but who may go to a social services organization to get similar data. It could be PHI that a social services organization has. So how do we kind of think about standardizing the rules so that we don't have totally different systems going on in the healthcare and social services arenas? And then, you know, I think there was, we ended in a place where there is a helpful suggestion to really focus on the exceptions to the information blocking rule, particularly for social services, and really just focus the conversation here on out on what those are, how they maybe need to be tailored to meet social services needs, and kind of leave untouched the ones that already apply to you know, healthcare organizations subject to information blocking. I think we'll see at the next meeting if that holds true and what folks recommend in the meantime. I see Mary Sarah, you mentioned that we need to differentiate categories of social services. Yeah, I think that, you know, I think that's kind of the next layer of discussion and analysis too, is really digging in terms of, you know, how this may apply differently in a housing context compared to maybe a area agency on aging, right? And kind of going down the line with programs and use cases. Did folks have any other thoughts around the information blocking piece who may be tuned in? So
this is Deanne. I did kind of feel though, I thought it was really beneficial to listen to the PMP subcommittee in advance of yesterday's IAC meeting. And I really, and you're heading there probably, like I liked the input yesterday because first off, either State or Manette seemed to position that under the DXF, information blocking is different because of these other entity types that are not bound to that. And it seemed to be, yesterday's discussion to me seemed to be more of a separation from the federal information blocking rule to where they're thinking of going. And so I thought it was a good input yesterday when somebody said, well, maybe we shouldn't call it information blocking PMP then, because don't use the same two words if you're saying it is different.
Yeah, no, I agree with you. I think I also found it helpful to like have listened to this too, because I think you could tell there is the clear throughput. But yeah, I think where they really landed here was like, let's not fiddle too much with the requirements for those already subject to the federal rule. Let's kind of think through, and it's exciting, but feels kind of like uncharted territory too in some ways, figuring this out in the social services context, which is like a bolus of sectors within it. And I think there's a lot more that needs to be unpacked before, you know, there's like a clear kind of PMP. Just a couple other, you know, subjects that were brought up. So they did also touch on the monitoring and auditing PNP. This came up in yesterday's implementation advisory meeting too. A couple points that were brought up around monitoring and auditing. So what was proposed was that, you know, CalHHS would reserve the right to conduct periodic audits of, you know, the books and come on premises of, you know, signatories, offices to review records and such. And a couple ideas came up in conversation. One was, you know, what's the role of a QHIO in potentially verifying in potentially an enforcement too? You know, the qualified entities, do they have a role to play in monitoring and auditing in some ways? You know, sort of the actor in the middle. Additionally, the idea came up, is there could we consider a complaint process versus an audit basis? was one idea. So rather than proving you're in compliance with information blocking, kind of have a post facto complaint basis where, you know, you show that, you know, you fit within an exception based on a particular complaint that comes in. And then the other was around considering how government agencies and social services, again, may need to be treated differently than healthcare organizations when it comes to audits. I think this particularly was raised by some of the folks from state departments who brought up that, you know, this might open up a lot of their books, you know, quote unquote, to inspection. So, you know, what is being looked at, what won't be looked at, what are the implications? You know, I do think we got the sense that there will be auditing. There will be an auditing versus a complaint basis. But it was voiced over that, you know, there are limited resources to be doing these audits. So these won't be super frequent events. And then there was just a brief conversation around the technical requirements, policy and procedure. There wasn't as much discussion on this item. And really, you know, it was a great kind of overview of what the different transaction patterns would look like, you know, in the context of kind of alignment with federal standards, avoiding sending information that's not requested. You know, can we think about how to signal that broadcast should be used sparingly? So 4 patterns were laid out around, you know, targeted delivery, requested notifications, targeted requests, and then broadcast requests as well. I think there is feedback that in addition to, you know, IHE profiles, that folks should be able to use FHIR as an optional specification if they'd like to sort of, you know, be in line with, I guess, where, you know, industry is ideally going. That folks should be sharing regardless in electronic formats. And Deanne, I think you had a great comment yesterday that we should do away with faxes under the DXF. You know, I don't think we could say that enough. And yeah, I think you know, there was limited time for discussion at this meeting last week, but it sounds like this will be continued at future meetings. Any other thoughts from this meeting, this subcommittee meeting last week? Anything else? Yes, no faxing. I agree, Timmy.
Did you get a sense of how we're gonna like null this? How quickly we're gonna get to them?
That's a good question. I think the state's trying to move quickly. So I guess we'll see at the next meeting what drafts come out and what legwork is done in the meantime.
Sorry, Robbie, do you mind just repeating the question since she was off camera?
Oh, yes, sorry about that. Timmy was asking, do we get a sense for the timeline? And I think CalHHS is trying to move quickly to get these PMPs up, ideally ahead of the new year, or at least, you know, as folks are signing.
And just also, so the process will be they'll send a draft out and then we get to.
Yes, everything will be available for public comment. So actually, that's a good, so we can move into the IAC meeting that occurred. So to your point, Timmy, you know, it looks like in terms of the topics that'll be discussed at the next IAC meeting will be around QHIO criteria. So that's being prioritized, as well as, you know, the first version of the monitoring and auditing PMP as well. And then in February, first round PMPs in development, like the remaining final versions, hopefully, you know, will get approved then. So early next year, I think we'll have a sense for what the final versions look like. But they did mention, you know, all PMPs will be made available for public comment to, you know, a certain extent. Unclear what the timeline might be like for feedback, but there'll be an opportunity, including for the coalition too. They did say that info blocking policy and procedure the draft is anticipated to be ready by the next PMP subcommittee in December. So I think that one will have more clarity on at the next meeting. They did mention too, you know, they're changing the DSA to strike the reference of signing an agreement with CalHHS, but really kind of like among the signatories. So just clarifying that for folks, and that they will have a self-service portal for signatories to be able to sign the DSA. And there was a lot of good input, and Deanne, I know you had a lot to offer too, just in terms of like, what's the information that's being collected, can you kind of check the box on, is it provider organization or FQHC? And, what kind of level of specificity are we getting to in terms of signing the DSA? So I think we'll see more to come from there. I think just again on the PMPs, that the concerns around making your books available and on-site visits came up again on the committee meeting yesterday. So similar feedback. There was discussion around the QHIO qualification process and the principles that were proposed, 3 in particular, and there were some suggestions to add equity and accessibility as principles in thinking about the qualification process, and having open networks and participation, and allowing for organizations to onboard with these QHIOs. Around the educational grants, they did mention that they received 12 applications, and will notify folks in November of awardees. So we should hear back from CalHHS soon as well.
Yeah, I'll throw in there. I was thinking that they wouldn't get them out before Thanksgiving because of that week extension, but with 12 applications, they certainly should be able to stick to the week of November 14th, hopefully.
Yeah. I guess we'll see. Fingers crossed, we can all hear back ahead of the holidays. They did give a little information about the TA and QHIO onboarding grants too. And there, I think, were questions around, who's being prioritized and why, and, helpful feedback that, counties are really interested and curious to learn more and participate, but they're not a required signatory. So what's the balance to strike between making sure those who are required are getting all the support they need, and then, other stakeholders who want to sign on? And then there was, a good presentation at the end just around the digital identities work and some of the components of that, in terms of, all the way from identity assurance to person matching. I think there were some really great open questions to folks. So, to the extent folks on this call have input, what are existing initiatives underway that can be leveraged? Karen Alliance's work came up. I know we put some comments in our some ideas in our summer comments on this subject, but if other folks have ideas, CalHHS is looking for them when it comes to assurance, authentication, and such. Jim, I saw your face appear.
Are they looking for other pilots or demonstrations? It's kind of interesting because this conversation, to be candid with everybody, came up during the one of the care equality discussions. And, part of it is some of these architectures, whether it's the Karen Alliance, Federated Identity Pilot, and the others, are using like the XUA profile and SAML and things like that, which are still effective, but in many cases are like 10 years old for how we're moving information around. And many of the people here know that I'm involved with a number of other initiatives which are being deployed in a whole bunch of other countries, and they're just alternative architectures to consider, or even hybrid architectures, which some companies are doing. So I just don't know how to inject interest or discussion about that.
That's a great question. Rim, I don't mean to pick on you, but I might punt that one to you in case. Is there anything in particular you'd like to see stakeholders, provide feedback to you on?
Well, thanks. The discussion at the IAC meeting yesterday was really on how we were thinking about incorporating some of the other components that people often think of as part of identity that include IDAM beyond just person matching. And as you said, our questions are these appropriate components to be thinking about as part of the data exchange framework? And if so, what should we be leveraging as we explore? And so I think we're interested at this point in just understanding what it is that's going on, what we should be watching, so that we don't reinvent wheels that are already well in place. I don't know that there's any specific request for information we're looking for, just input.
Excellent, thank you. And Deanne, never mind. All right, so yeah, I guess please send any and all ideas to Rim. It sounds like. Thank you, Rim. And I think too, just so upcoming meetings are on folks' radars. So there'll be another webinar on the 22nd around the data exchange framework grants and signing instructions. So tune in for that one. We'll be there as well. The policies and procedures subcommittees meeting in December. I think info blocking, we'll get more line of sight into where the thinking is there. And then lastly, the implementation advisory committee is also meeting in December again. Just to note for folks, so we have 3 more remaining meetings this year. Do note the time change for our meeting on the 17th. We'll be meeting from 12 to 1. And then back to our regularly scheduled time on the 1st and 15th. So we'll make sure to send a reminder in our roundup and ahead of the next meeting as well. And then just another announcement too, and we're super excited about these. We've got, I think, really good participants teed up for these 2 upcoming workshops we'll be hosting. Co-hosting with ITEP with Insure the Uninsured project, and the second one as well with the California Association of Area Agencies on Aging. I always get tripped on that one. With support from both Blue Shield and Cedars-Sinai as well. Really, this first one next Monday at 1 o'clock is going to be focused on data sharing to support people experiencing homelessness in LA County. We've got some great speakers from 2 housing agencies who are CalAIM providers with several of the health plans in LA County. We have a representative from the Clinic Association participating as well. A lot of the federally qualified health centers are ECM providers in LA. As well as a representative from LA Care, who's been really deep in the weeds, over the past decade, from whole person care and health homes all the way to CalAIM at the present. So it should be a really good conversation, really focused on, how can we braid together health and HMIS and, CBO data, what's needed, what are some of the specific use cases to focus on, and what's really needed when it comes to things like data sharing agreements and template language and some other ideas have come up too. And then additionally on the 16th at 3 o'clock, we'll have another one focus a little bit more statewide, but on older adults. So through the AAAs. This one we've got a few speakers lined up, but Dan, who's on this call, will be speaking. As well as Lori from the State Association of HIEs, Anastasia Dodson from DHCS is participating, as well as representatives from Anthem and Partners in Care Foundation too. So I think this one will be really exciting in the context of the work going on in CalAIM around duals integration and long-term care, plus ECM and community supports and the population health management work, right? We've got a lot going on. What's the role that AAAs can play in providing data that will be useful to all these initiatives, and what sort of data would be useful to them, and how can we kind of scope out what's needed? So I think we're really excited for these.
I'll add some commentary here. I just think the thought and the engagement that's gone into planning both of these workshops, it's been tremendous, and we started talking about this in June. So being able to get these folks in the same room together and have this kind of time virtually, we'd all like to be in person. I just think it's a huge opportunity. It's going to hopefully spark, the first of several conversations. If you can join, I really hope you can. It'll be recorded. We plan on using this information to be able to really help with our, our better understanding and how these PNPs and the data exchange framework is going to be rolled out. Especially, I think we started this whole concept that we're going to stress test the data sharing agreement for CBOs. And again, just thank you all for helping us to get it to this place. And we'll be keeping you posted on what we hear, what we learn, and this engagement with organizations that don't typically engage in this conversation. So we're excited. Thank you, ITEP, for your help in this as well. And we can put out this information to everyone and make sure that they drive some and get some participation. But you said this morning we already have over 100 people registered for.
Yeah, we've got quite a few registrants for Monday, and recommend folks, if you can, register to the links in today's meeting materials.
So thank you, Robbie, for all your work on this.
Thank you to folks on this call who've been super helpful in identifying speakers. And if you're wondering what is HMIS, what's a COC, what was whole person care and HIP and all these other acronyms, I think a lot of that will be unpacked on Monday, within this kind of housing and healthcare context. So
thank you, Katie.
Yes, thank you to Katie Heidern too for helping us. Sorry. Oh, and Katie Weber, yes, with the AAA one. So we hope to see everyone next week. And just additionally, a couple other items. Almost all of these were in our roundup this week. There's a really great virtual event that STAT hosted recently with Lisa Bari of Civitas Networks for Health, and she did bring up AB 133 in the context of, I think the title was "Can we share data without being evil?" And how do we create an interoperability environment that really, focuses on patients' needs and getting data to the right places it needs to be. A couple other items in here, a really good Jamia article on approaches to protecting reproductive health information post-Dobbs, which I think really aligns well with the conversation we had at our last meeting around, what can happen here in California. There's also a new white paper out from Blue Shield focused on how health plans can support SDOH and social needs data exchange. So along the same lines of, the conversation we'll be having at our workshops. And similarly, a McKinsey article that outlines federal funding opportunities for SDOH technology infrastructure. And one other item too, there is an upcoming RISE SDOH forum in late November in DC. Let us know if you'll be there. I'll be attending. Would love to connect if you'll be there. So let us know.
Yeah, and I think we should just keep up the get together. So if you are going to be there or you're in town, let us know and we will find a place and space to host getting together. So thank you, Robbie, for going to that.
Yeah, thank you all. Let us know and we can organize something. And then just, additionally, we just wanted to kind of, touch base on, what we've got planned through the end of the year, kind of looking into 2023. We are looking to publish the blueprint around funding that, we've been discussing at several meetings, as well as an issue brief on reproductive health data sharing recommendations for California. So we're looking to get those completed this month. We'll host our workshops. Please tune in. We're going to convert, I think, our last meeting on December 15th into more of a policy briefing or policy discussion, if you will, around, what are we looking to next year? What's the outlook for 2023? And then, I think as well with that, really finalized priorities for 2023. We welcome ideas for how you'd like to collaborate on projects and stuff, Doug. We'd love to have you blog and retweet our content on Twitter so we can connect offline on that. But as we plan for next year, if ideas come up about how we can co-host events or educational materials and such, please reach out because we'd love to collaborate with you all on that. And I think that's it in terms of our programming for today. Just a reminder, our next meeting's on the 17th at 12 o'clock. On Thursday, the 17th. So hope to see you there in our 2 workshops in the meantime. So thanks everyone for coming out today and have a great weekend.
Thank you.
Bye, everyone.
Thanks. Bye. Thanks, Robbie.